Have you been using LH strips and tracking your basal body temperature, but are still unsure of when you're most fertile? Cervical mucus might be the missing key. If you want to avoid missing your fertile window, you need to be able to recognize your cervical mucus, understand its types, know when to expect each one, and be able to understand when ovulation is about to happen without using apps or guesswork. Hi, I'm Ina, a naturopathic doctor focused on fertility and a proud mama of 4 after 30. Cervical mucus is one of the most powerful fertility signs that we have because it tells us about your hormones in real time. And once you get it and you can read it, it really makes your cycles make sense. Cervical mucus is actually meant to keep things out. Only fertile cervical mucus, it's what lets sperm in. So recognizing it really matters. So, what is cervical mucus? Well, cervical mucus is produced by the cervix, and it's actually meant for protection, not fertility. It acts almost like a gatekeeper, and its job is to keep things out. So it makes sure that your cervix remains closed, and things like bacteria and other pathogens, and yes, even sperm, are kept out of your uterus. By default, cervical mucus is hostile to sperm, which means that they cannot survive or travel through the cervix unless the cervical mucus changes. And for that to happen, we need estrogen. After your period, estrogen begins to rise and it peaks right before ovulation. When I was suffering with unexplained secondary infertility after my first child, I was doing a lot of cycle tracking, which required a lot of monthly blood work to figure out what my hormones are doing. But if you can understand your cervical mucus, it can tell you almost as much information, and it can explain what's going on with your hormones and your fertility throughout your cycle. As estrogen rises, you will notice two things. First of all, the amount of discharge will increase. And secondly, there will be clear changes in its texture. Other things that are also happening and changing that you will not notice is the fact that the cervical mucus becomes less acidic and a lot more sperm friendly. As estrogen peaks towards the middle of your cycle, cervical mucus actually switches roles. And fertile cervical mucus actually protects the sperm from the acidic environment of the vagina, helps them swim, and nourishes them so that they can survive for up to 5 days in the female reproductive tract. Therefore, having fertile cervical mucus is essential for conception. However, if you notice that your cervical mucus is absent or it's very short-lived, even a perfectly healthy sperm and egg might never get the chance to meet. So to recap, cervical mucus really tells us 3 main things: how well estrogen is rising, if your cervix is opening, and if the conditions are right for conception. Unlike LH and basal body temperature, cervical mucus gives us real-time access to uterus, and it tells us when ovulation is going to happen and if your body is ready to welcome sperm in. Now that we know the why, let's get into the how. So, first, you do not want to check cervical mucus internally. There's no need for that. All our fingers have pathogens on them, and even if we wash them and they're clean, there's always a chance of introducing some kind of bacteria in there, and we don't want to do any of that. What you do want to do is you want to start checking right after you finish your period. You go to the bathroom, you wipe, and then you look at the toilet paper. Or you can see if there's any residue on your underwear. What you don't want to do is you don't want to check after intercourse, after using any lubricants, and you don't want to mistake sexual arousal fluid for cervical mucus. You want to start checking as soon as your period is done, and you want to check every time you go to the bathroom. You check so frequently because the changes in cervical mucus can be very slight and some of them very short-lived. So it'll be very difficult for you to figure out what is happening if you don't check on a consistent basis. Now that you're checking every time you go to the bathroom, what are you looking for? There are 5 types of cervical mucus that we will discuss. They all look different, and each of them tells us something unique about your levels of estrogen and what's happening with your fertility at this time of the month. Type number 1 would be dry. This will feel dry. There will be nothing on the toilet paper when you wipe, and it may even feel a little bit rough as you're wiping. This tells us that estrogen is very low, as is your fertility. You expect to see this type of mucus at the beginning of your cycle, right after you're done your period. You might see this right after ovulation, and if you're just about to start your next cycle, it might be like that as well. The second type of cervical mucus that you would notice is called sticky. It is thick, tacky, and though it might stretch, it will break very easily. This tells us that estrogen is slowly starting to rise, but your fertility remains pretty low, although it is improving. You're likely to see this kind of cervical mucus in the early to mid follicular phase. If you think about your cycle, the first part of your cycle is the follicular phase. This is the egg growing phase. Then you have ovulation, and then you have what is the luteal phase, or the infamous 2-week wait. So in the early to mid follicular phase is when you expect to see sticky cervical mucus. The third type of cervical mucus is called creamy. This is going to be lotion-like creamy consistency. It'll be white to pale yellow. It tells us that estrogen is rising well and your fertility is actually moderate. You expect to see this type of cervical mucus several days before ovulation. And this is really the first type of cervical mucus that makes pregnancy at all possible. The fourth kind of cervical mucus is called watery. It will be wet, clear, and it may even soak your underwear. This tells us this estrogen is high, as is your fertility, and this will happen 1 to 3 days before ovulation. And finally, the fifth type of cervical mucus is the egg white cervical mucus. It is egg white consistency, it is slippery and wet, and it stretches even to a few centimeters without breaking. This tells us that estrogen is at its peak, as is your fertility, and this usually happens the day before or even the day of ovulation. This is the most sperm-friendly kind of cervical mucus. Now that you know what you're looking for, this is what you're definitely not looking for. If you notice anything that's thick, clammy, white, cottage cheesy, any discharge that's yellow or green, any discharge that's gray or milky white with a fishy kind of odor, anything that's rust colored or brownish that's not part of your period. Anytime you have discharge that's watery, but it does not change to any other form, just remains watery throughout the cycle, or any increases in the amount of discharge that you have, anything associated with itching, burning, or pain, you should really talk to your doctor, because these could give us clues about maybe some other underlying conditions. Any of them will make getting pregnant more difficult. Now that you've been tracking your cervical mucus, it can really help you figure out when your fertile window is, because virtually all pregnancies happen from intercourse before ovulation, because sperm can live for up to 5 days inside the reproductive tract, but your egg only has 12 to 24 hours, and sperm is not there to catch it when it's released. It seriously decreases your chances. So your peak fertility will look like having that watery or egg white type of cervical mucus, followed by an LH surge, followed by ovulation. Now that you know the types of cervical mucus, it is important to chart them. The reason you want to chart is because next month you will not remember what your cervical mucus was doing this month. The way you want to chart it is once daily, and you want to chart the best quality cervical mucus that you saw that day. This means that if they wake up in the morning and you see creamy type of cervical mucus, but towards the evening it changed to watery, you would record watery for that day. What you're looking for throughout the cycle is the progression of your cervical mucus, which tells us what estrogen is doing in your body. And overall, over multiple cycles, what you're looking for are patterns. Daily changes are not as important as the actual patterns that we're going to be able to figure out when you track this daily. If you do not have a fertility tracking chart, I have created one and it is linked in the description below. Please choose Celsius or Fahrenheit, and happy tracking! Cervical mucus works best when it's combined with LH strips and basal body temperature monitoring, because the cervical mucus will tell us that ovulation is approaching. LH surge confirmed by LH strips will let us know that ovulation is imminent and it's going to happen in the next 24 hours or so. And a basal body temperature spike will let us know that ovulation has happened, so you will have some confirmation. I have separate videos on how to use LH strips and how to track your basal body temperature, and they're also linked in the description below. Now that you've been tracking your cervical mucus and charting it daily, here are 3 common patterns that I often see in my patients telling us that maybe something is a little bit off. Pattern number 1, little to no fertile cervical mucus. What you would notice is that most of the time you have dry or sticky type of cervical mucus, or if you do have fertile cervical mucus, it is very short-lived. This tells us that estrogen levels are low. There may be dehydration or stress. Some things that might help are ensuring adequate hydration, balanced meals, stress reduction, and it's really good to track this over a number of cycles to make sure that this is a true pattern. Pattern number 2 is fertile cervical mucus appearing late in the cycle. What you may notice is that creamy or egg white cervical mucus appearing very late. That tells us that you might have delayed ovulation, or there may be stress, illness, or travel. Things that help are consistent sleep, regular meals, and making sure that you're not over-exercising. Pattern number 3 is cervical mucus never progressing past that creamy stage. So what you'd notice is that you get none of that watery or egg white quality cervical mucus. What that can tell us is that estrogen is not peaking properly and ovulation may be weak. Things that might help are making sure that you get adequate calories, stress reduction, and it's really good to track LH and basal body temperature with this type of pattern because it can really tell us what's happening with your ovulation. What can help with this type of pattern is making sure that you have adequate calorie intake, doing some stress reduction, and tracking LH and basal body temperature alongside, because sometimes weaker ovulation is normal and sometimes it's not, depending on, it might look like weaker ovulation, but for you, that's your normal. So it really helps for this particular pattern to have the full picture. You don't need perfect cervical mucus or textbook cycles. Cervical mucus is about patterns, not perfection. And understanding your cervical mucus allows you to stop the guesswork and start timing with confidence. If you enjoyed this video, subscribe and follow along for more bite-sized fertility clarity.